So people seek a naturopathic doctor or naturopathic medicine or natural medicine when the conventional stuff doesn't work. Listen, if the doctor had given me a pill and I could have gotten better, I would have done that. I didn't want to do all this. I did this because I had to. Now I love it, but I'm going to tell you, people are not doing natural medicine to be difficult or to make your life challenging or to raise a fist to the system, down with the man. They just want to get better. That's why they seek options. So people seek us when conventional options run out. When a 7-year-old girl has Crohn's and the doctor said there's nothing more we can do, we're going to do surgery. Or we're going to put her on Remicade, which is known to cause cancer. Or they're going to put her on methotrexate, which is known to cause cancer at 7 years old. You can't do that to a 7-year-old. So conventional options run out, and then people come to us. And those are the people that see us as naturopathic doctors or as acupuncturists or the other professions, chiropractic doctors that are in the audience. And that's what we deal with. So we deal with the worst of the worst. And like anything challenging, it gets you pretty good at what you're doing. But it is about different perspectives. I'm not here to argue that naturopathic medicine is the right way. Sometimes it is, sometimes it's not. There's a good role for conventional medicine. Okay, we all know what that is. From hemorrhaging from a car accident, don't put a herbal compress on it, all right? I get that, all right? But there are also perspectives that don't work, okay? So if someone has hypertension, you don't immediately just put them on hypertensive drugs because hypertensive drugs are associated with increased risk of cancer. So that doesn't make any sense either. So I'm not here to argue which perspective is right. Chiropractic has something beautiful to offer, acupuncture, and just people that are knowledgeable and caring. All right, so let me just tell you about some cases. And when I showed this to a colleague, they said, wait a minute, all the cases you've cured and you're going to talk about these? But these cases are close to my heart because this is my family. The things I'm talking to you about today, this is what I do with my family. This is what I do with my kids. So you heard my story about me, okay? 15 years of ulcerative colitis. Everyone that had the same intensity of symptoms that I did at that age is dead. You can only go on for prednisone for a certain number of years before you get cancer. Inflammation plus immune suppression equals cancer. Inflammation, colitis, immune suppression, prednisone, you get a tumor and you die. Okay? So my story is that I'm here and I'm healthy today. And I like being that way. My mom, okay, the worst case of hypertension I've ever treated. The most frustrating case. She was diagnosed about the same year I graduated. For 15 years I tried to treat that case. I couldn't get it under control. Finally she had to go on drugs. And the drugs had the side effects, and she got the side effects. 2 years ago, I did this hidden food allergy testing I'm going to talk to you about on her, this IgG food allergen testing. 2 weeks after going off eggs, which came up high for her, completely normal blood pressure. I mean, that's transformative. That's information. And that's what in my life I really specialize in doing is I want to figure out, because I'm a scientist at heart, I think. That's what really interests me in life. I like to read physics in my spare time. I mean, that's the kind of thing that fascinates. What is the unknown factor in a case that we don't know that we can change the case and change the entire course of health? My mom's on no hypertension meds. You can ask her. She won't lie to you. If I made up the story, she'll tell you. He made it all up. My dad, when I graduated from naturopathic school, could barely even walk. He'd play football on Sunday because he's a football nut. And for 4 or 5 days, he couldn't walk, normally, if at all. Okay? Now he plays tennis 3 days a week for 2 hours and 4 hours of football on Sunday with guys in their 30s, 40s, and 50s. He's 81 years old. So you can go up and talk to him after, and he'll tell you. My brother Kyle, very brilliant guy, top lawyer in Chicago, business lawyer, had to give up his practice from Crohn's. Okay? Crohn's disease, GI problems, frequent bowel movements, couldn't take the train to work. Complete frustration with that case. 2 years ago, I did the test on him. For 2 months, he did the diet. And he called me up. He said, this isn't working. He's like, it's frustrating. I'm not getting results. And just then, I was starting to get some good results. My mom was really being encouraging because she had given up gluten. She's like, she was getting improvement in her symptoms. So I said, Kyle, just stick with it. Just stick with it for a little while longer. 2 weeks later, he called me. Everything cured. From 12 bowel movements a day to 0. Complete healing of that case. My sister Katie, diagnosed with MS, lesions in her brain, okay, completely cured. When you hit the core of the case, you can really make amazing changes. And that's what I would expect in any case I treat now. So here's a case. Here's a patient. I'm going to speed it up a little bit. This is what we see in practice. Patient's been to every specialist, unmanageable pulse, goes to work out, pulse is up to 190, chronic joint pain, nausea and vomiting, weight gain, fluid retention, insomnia, foggy concentration. We might see a patient can't remember, or patients with anxiety or depression. Okay, this is one patient. So what do you do with this patient? You say it's all in your head. Go get a trainer. That's what they said to her. But I like her because she's a naturopathic patient. So what does she say? I can't wait. That's it. I'm done with this nonsense. I'm going to find something else. And she does. And she came to see me. So I'm going to show you her test, the test we did on her. I love those patients. I expect you to get better. If I treat you, I expect you to get better. I don't want you to wait around. And it doesn't take 6 months. It doesn't take a year. You should get better. Not every case. I'm not guaranteeing. Some cases are a struggle. I still don't have all the answers. Most cases get better. So this is where you end up, which way should I go?